So first you need to palpate. Is it necessary to do it? Look, here. We examine the thoraco-abdominal diaphragm. Here it's good. But here somehow, here somehow. Here you see how gently the hands penetrate. But here it feels like there's some tension right here. You don't press it, you don't know what it is. You place one hand, you place the other hand. Don't press on anything. The patient presses their hand against me. Stronger, 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 stronger. Exhale and relax. Gently, gently, gently. Everything started to rumble. Everything rumbled, it rumbled. Inhale. Exhale and relax. Just like that, slowly. There should be no pain for the patient. And add a light vibration on the exhale. Look, how painful. How painful. Isn't it a miracle? To be continued. It's better to meet from this side and make this kind of movement, like this. Not pressing like this, but pressing like this, as if rolling. Let's see. Here. Good. We haven't worked on this area. Grasp the muscle. Shift it to the side. Underneath you is the pectoralis minor. See, it's like a little bubble rolling. Lifted your hands towards me and exhaled. Try to lift my hand. There, 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 and exhale. Inhale and exhale. Now it's good. Now it has settled well. You feel it, right? And how the lung is working well. Once more. Now, I understand. Hands again. Pain? Less? Less. But still there. Let's go lower. Looked here. Well, I asked. Palpated here. Looked. How's the pain? The same, I think. Found it here. Look how it is here. I was removing it like this, like this. It changes after childbirth right here. We won't touch the hernia, we'll just check the ribs. Nothing here. Nothing here. Nothing here. Well?
Well, accordingly, if there's nothing here, the question is nowhere. To be continued.
Were you able to capture the face? Look here once more. Move it over here. There is pain. Move it over here. No pain. Every morning, you should check this pain and do this exercise. Please look at what it involves. You place your hand with the base of the palm right here, and you press the hand. And you do nothing else with the stomach. You do nothing with the stomach. Colleagues, the third, next point. My patient still has pain. We worked on the thoraco-abdominal diaphragm, but the pain is still present. Then I place my hands near the lymphatic cistern. I shift the tissue in one direction. Can you see that I'm shifting it? The pain remains as it was. But when I shift in the other direction, the pain decreases. The point is that you don't need to press anything in the stomach. You just place your hand with the base of the palm and the other hand on top. And you hold your hands like this. Bend your legs, and the legs move in the opposite, right here. The point is that you don't know visceral therapy. You just need to perform the therapeutic technique. And the patient does it themselves. Inhale with your stomach. Exhale and lower. And he will lower his legs as much as he deems necessary. He won't do anything more personally, you understand. Inhale, exhale, and lower the legs. Just like that. Yes, inhale well. This entire technique is absolutely painless. Inhale and relax. Just like that. I want to check how the pain is. Lower your legs. Is it painful? No. No pain. Every morning, before getting up, you first perform the lymphatic technique. I check, is this enough? Maybe something else needs to be done. I'm looking at the K27 points. How is the pain? There's a little bit here. There's still just a little bit of pain here. How about here? And lastly, it's the lymph nodes themselves, which are distributed throughout the human body. Try pressing your foot against my hand. No, no. There, 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 there. And relax. There, 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 there. And relax. The pressure that is needed, she applies herself on your hand. There you go. And relax. How painful is it? No. Please. You have 5 minutes to practice. Faster, faster, faster.